I have to let everyone know that we are recording as we're speaking. Please make sure you all are on mute. We are recording, so if you have any issues with us recording, please sign off, but otherwise make sure that you're happy with us recording. Please, everyone, stay on mute. Right, it is on 7 o'clock or 9 o'clock Dubai time. Just to let you know, Bianca, I've got some patients from Dubai that have joined. So we're international on our first go. And okay. I'd like to tell everyone, thank you very much for joining us. This is the first in a series called Finding Health. And for those of you who don't necessarily know or remember, that I really want to have conversations with different people. And Bianca, I've got to let you know, you were the one who started this conversation in my head. You and I chatted on the phone maybe about a month ago. And I just really liked how you were talking and what you had to say. And I said, well, maybe we should do a Zoom chat. And then I got back from that and I thought, well, maybe if we put a series together where we interview different people and talk about health. So to start off with, I just want to tell you what I believe in. And then Bianca, we're going to go through and discuss with you and ask some questions. And anyone on the talk, if you want to ask a question or something that Bianca says that you need to clarify further, please, will you put a chat in place? Please do not unmute yourself.
There are things on the screen. Can I see them? They can't see me. They can't see
you. Thank you, Wendy. Can everyone mute themselves? Saba, if you can mute yourself as well. Right. So I firmly believe that health is more than what you eat and drink, whether you exercise or not, or whether you avoid certain items. I firmly believe that health is diverse, dynamic, and deliberate. I firmly believe that health is not possible under the hand of only one practitioner or one discipline of medicine or healthcare. I firmly believe that health is the person's primary responsibility, and you must make it person-specific. I firmly believe that health must be conversed on physical, chemical, emotional, mental, spiritual, racial, and various other undetermined levels. I firmly believe that there must be a better way than what is our current status quo. So with all of that being said, Bianca, the floor is yours. Please tell everyone about who you are. But you're going to have to unmute yourself, Bianca. Hang on a second, unmute yourself.
You muted me when you muted everyone.
I apologize.
That's fine. Okay, hello everyone, and thank you very much for joining. My name is Bianca, and thank you for joining from overseas. Internationally, touching base with international people is quite amazing as well. So I'm Bianca. I'm the owner and founder of Lymphatica. So Lymphatica is a specialized lymphatics practice in Centurion. We're quite the biggest lymphatic detox practice currently in the country. And my passion really is just the lymphatics and understanding the lymphatics and working with a scope of different practitioners for people to have optimal health.
I'm going to interrupt you straight away, Bianca. Why is the lymphatics your passion?
Okay, so I have a story. In 2015, my mother passed away after fighting lymphedema for 4 years, and she passed at the age of 44. So I'm of the firm belief that if they caught it quite earlier and if the practitioners understood the lymphatics quite better and had an interest in the lymphatics, she would have still been with us today. So that's what sparked the initial interest in the lymphatics, is to understand why she passed away. 5 years later, now I own my own practice where I do work with these types of patients.
And I mean, I know when we spoke, I said to you, I think the lymphatics are very underestimated. Just give us a little understanding. What is the lymphatic system?
So I'm going to explain it to you like I explain it to everyone. The lymphatic system is your sewage system. So no house will function without a sewage system. And that's what we see as the sewage system of the body. So any toxins build up from your environment, food, water, everyday life to life collects in the lymphatic system of the body, and your sewage system needs to be able to get rid of it before your body will function 100% in all sets.
Yeah, I mean, certainly one of the things that I know of that an effective body is a body that's eliminating. But
Yes.
how does it get from the sewage system to the elimination system?
So basically, it's all to do with your lymphocytes, your white blood cells. So your lymphocytes is your detox cells, and they actually collect the debris. It's little trucks that go through your blood system and collect all the debris through the body. And then it actually goes through the different detoxification organs like your pancreas, your liver, your kidneys, and then comes through out as waste. So urination, stool, any type of thing, sweating like that. So if one of those functions in the body doesn't speak to each other or doesn't work correctly, your body is going to retain toxins and then normally start retaining water, and that's where edema forms as well.
So how does that occur? Let's break that down specifically. How will the elimination system or the lymphatic system undergo dysfunction?
So dysfunction happens normally when your cells, let's talk about something that everyone goes through these days, and it's something I was taught a while ago. It's about oxidative stress. So oxidative stress on the cells itself forms like little holes in the cell membrane itself, and then you actually collect the waste in the cell, and the cell actually gets too heavy to drain through the body. In the sense, what I mean when I'm saying that is like your body, your kidneys can't function and detox heavy cells. Your liver can't function and detox too many heavy, elated and filled cells through the body. And then your lymphatic system actually retains those different types of cells, and then the fluid retention starts, the acidity, the inflammation, all those types of symptoms and starts in the body.
So in essence, someone needs to know how effective their lymphatic system is working before you have a conversation of whether someone's eliminating correctly or not. Because in practice, I see patients all the time. They're not sweating correctly. They're not urinating correctly. They're not breathing correctly. They don't have good bowel motions. But presumably before that, you have to have a conversation with the lymphatic system.
Yes, and I think the importance of the lymphatic system is we need to start teaching from a young age the importance of the lymphatic system, because we as parents, and I'm not a parent myself yet, I see it with my patients, they tell me, yes, my daughter goes to the loo at the preschool or at the school or at high school. But in essence, we want, if you drink a 2-liter bottle of fluid a day, you need to basically urinate a 2-liter bottle of fluid. So these are little things of the body and the dysfunction of the body that we can pick up from a very young age. And these are little warning signs we can pick up from a very young age. And these are the type of discussions we need to start having from a younger age so that we can actually pick up red flags.
Well, let's dive into that right now. I mean, there's a whole bunch of people on this call and this talk. What would you say that they should be looking at right now in themselves? Is there a checklist that you would say that they should be looking at straight away?
Basically, what we start off with in our practice is the bowel movement. Do you have consistent bowel movement? Do you have consistent stools? Does your bowel movement on an only schedule? Is it the same consistency? I am a strong believer, and I'm sure you as well, of the gut health and how the gut health actually affects the body and, in my sense, the lymphatic system. So a small young toddler with, and I'm sorry if I step on any toes, with behavioral problems, and if they have not a consistent stool or not the same consistency of bowel movement, their bodies are retaining stuff that's going to cause inflammation, that is going to cause an effect on how the child operates. So we, in general, from any age, start at the bowel movement and the consistency of the stools. And that gives a big answer of how much does your body detox? Does your body detox the day before's toxicity that they've been in contact with? So that's what type of stuff that we look at.
And certainly when it comes to bowel motion, I find that a lot of people don't necessarily look at their bowel motion or take notice of it. It's go to the toilet, flush it down, move on with life.
And that's the sad thing. I mean, at this stage, we are seeing patients in South Africa that, with all honesty and without any type of shock, tell me that they only go for a bowel movement once in every 3 weeks. And it's not a problem for them, where for us, it's a very big concern because your body is not detoxifying in any way.
Sure. Yeah, I mean, not to personally share, but I'm at 3 to 5 a day. I go to the toilet 3 to 5 times a day, and I think that's pretty good. What other signs would you say are important for patients to look at?
So with the lymphatic system, your sinuses is one of the first red flags that you do see. So people who tend up to puff around the eyes or tend up to tell me that they do experience some kind of sinus movement in the sense of irritation, itchy ears, dry mouth, different tastes that they experience in their mouth. Most of the time, a sluggish lymphatic system is a metal taste in your mouth, and people tend to think, yeah, it's just because I ate something strange now, but your mouth and the senses in your face is actually one of the biggest signs that something is wrong with your lymphatic system and the drainage thereof.
Sure. And I mean, you know, we live in Joburg. I don't know anyone who doesn't have sinus issues in Joburg. And
that's the thing.
And certainly patients in Dubai as well. There's a lot of pollution. And so, you know, your sinuses in Dubai are also terrible. Tell us more.
Yeah, so basically for us, it's my general consultation will start with the sinuses in this area and how it's draining. Another thing that we need to discuss in South Africa is people's teeth and how the teeth affects the lymphatic system. But to get back to the sinuses is this whole area, that's where this first type of fluid retention starts. And people that don't drain from the main nodes into this area will tend to have swollen wrists, swollen ankles. So one of your first signs is actually if you can't move to the side without feeling your nodes pull on this side, you will actually be backed up and you need to have some kind of drainage or detoxification happening.
Sure. And other signs that people should be looking at?
So there's a lot of things when we start talking about type of adrenal fatigue, itchy skin, mobility problems in the sense of being unable to walk like you used to walk a few months ago due to your body feeling heavy. Insomnia connects quite heavily into the lymphatic system not draining. People with different tastes of food, again, taste comes up. People with swollen fingertips to the hand itself. There's so many signs to actually, where your body actually gives a red flag to say, listen, something is up and your body is not getting rid of everything. But one of the main things, and it's quite an interesting thing that we've been seeing, is people tend to report that their belly button is wet when they get home every day. And people think it's from sweating, and it's actually not. It's your belly button right above your gut that can't tell you. That's actually telling.
I don't know if it's my internet signal or yours, Bianca, but I'm losing you. Maybe we should just pause for a moment.
Okay,
All right, can you hear me, Bianca?
yes, I can.
Good. You were telling me about the belly button.
Yeah, so I said we do a lot of data collection in our practice, and one of the things that people noted was a few people that the belly button is wet at the end of the day. And then we started, as people going through the detoxification process, the belly button gets drier and drier at the end of each day. So somehow the gut and the belly button should be connected in a sense of a warning sign that your lymphatic system is struggling to drain, and then it secretes out of the belly button.
I mean, you've just told me something that I have no idea about. And that was one of the reasons why I wanted to do this, is so that I could, learn. I mean, what I remember from anatomy, there is a connection from your belly button to your digestive system, because obviously in utero, you're getting your food through your belly button.
Yes.
But that dries up as soon as the umbilical cord is cut. But I do remember there's lymphatic vessels along that. I'm going to have to go back to my anatomy textbooks and go and read about that. I think that's fascinating. Certainly something that I don't want to dive into, and let's not mention anything about COVID, but let's talk about viruses and bacteria as a general conversation. How does the lymphatic system deal with this?
So basically what we see, and I'm gonna actually talk about my own perspective, someone who had COVID not too long ago, and I was quite ill. I actually, while I had COVID, I started treating my lymphatic system after taking my medication. So your lymphatic system actually picks up the meds and starts flushing it through your lymphatic system. So I healed quite quicker than the initial practitioner would, or the initial doctor said I would. So basically what happens is, any type of bacteria or infection, like we discussed over the phone as well, Lyme's disease, stuff like that. And then unfortunately, we have to mention COVID, is the lymphatic system picks it up and it's your white blood cells are affected. And if your lymphatic system is not functioning and your cells are not getting rid of that type of bacteria, you are going to stay ill for a longer time than the normal healthy person would, because your circulation system goes through over and over and over again, and your detoxification organs are not able to get rid of your lymphatic system and the toxins thereof.
So let's talk two things. Let's talk, number one, your process in your office, but let's also talk from a patient's point of view, what they can do from today in terms of starting to make their lymphatic system work more effectively.
Okay, so I'm going to start from an outpatient first, and then I'll explain more about our practice. But outpatients, we do believe in stuff like warm baths, warm Epsom salt baths, people taking stuff like dandelion and milk thistle. There's a lot of products on the market, natural lymph drops that you can buy from a pharmacy. So, but my point of first point of view is movement. If you're, and that's why I touch base with so many chiropractors as well. If your skeletal system and your muscle movements is in place, and you can be able to move better than which would be done yesterday, you can make a difference to your body. So your lymphatic system moves in two different ways. That's by manual pump or movement. And the movement is the muscle actually pumping your lymphatic vessels and your lymphatic water lines. So that's what we start people off with. We tell them, first and foremost, you have to start moving. Should it be moving up and down the passageway? Should it be moving to the bathroom? But if you can take 50 extra steps every day, your lymphatic system is going to drain more than it did yesterday. The second thing is we do believe in stuff like anti-inflammatory foods. I can send out lists of approved anti-inflammatory foods where your body doesn't react to the inflammation in the foods. We do believe in Epsom salt baths, warm baths, and then I am a very firm believer of starting with dry brushing, managing your lymphatic system at home.
Okay, now hang on a second. You've given me too much now. Let me back up. So first question is detoxing. So let's hang on a second. First question is detoxing. Second question is the chiropractic side, which I want to dive into a little bit. I don't want to make this a chiropractic talk, but I want to dive into that a little bit. And then you mentioned dry brushing, so I don't know anything about it. But let's go to the detox first.
Yes.
How often should someone be detoxing?
So generally, we don't want to cause your lymphatic system to get lazy, and it does tend to get lazy as soon as it does see that it does get help. Okay, so generally, you want to detox your body once every 7 days. Unfortunately, due to the areas we live in, like you said, Joburg has got a lot of pollution. Centurion as well has got a lot of pollution. So people tend to clog up quite quickly. So the idea is to
detox your body once every 7 days.
Yes.
No one's doing that. No one's doing that.
I know no one is doing that. That's why I'm busy.
Shit. No wonder we got problems, man.
Yes.
And do you have a specific detox protocols? I know in my office, I have a detox protocol, and maybe you and I can share that afterwards and we can chat. But do you have a specific detox protocol?
Yes, we do. We do make our own Epsom salts that we do call our detox bath salts. I do like people to detox through warm water. That's really one of my first go-tos, because then you actually start sweating through your lymphatic system. Your lymph comes through your skin. And then I do have a recipe for what we call like a detox juice that we do suggest people take. In all honesty, Dr. Travis, at this stage, the type of patients that visit us is severely obese. We've got people that weigh 300 kilograms due to lymphedema, due to retaining a lot of water. So it doesn't make sense putting someone like that onto a juice diet or a juice detox. So I do have different scopes for different oaks.
Sure. Okay, in terms of movement, the World Health Organization, maybe about 10, 15 years ago, came up with the 12,000 steps a day. And I feel that when they did that, they made that as a general conversation for all systems of the body. Do you find that is appropriate, or would someone be needing to do more than the 12,000 steps a day?
So it depends on the scale that you arrive at us. So we've got different scales of patients. We've got people who's been immobile for quite a long time, and we do get them to be mobile. For a general severe edema patient, it's absolutely impossible to walk 10,000 steps. But I do believe, as a practitioner myself, I reach about 8,000, 9,000 steps on a lucky day. And I do believe it's a big, quite number and a good number to chase.
Hang on a second. Yeah, I mean, I think I understand what you're saying in terms of the patients that are severely obese. I'm talking more from a preventative point of view, that if people are doing the 10,000 steps a day, that would prevent them from getting to that severe state.
Definitely. And that's why I say 9,000, 8,000, 10,000 steps is a very great benchmark to actually chase and to get it right every day, because that's going to make sure your lymphatic system is moving.
And something that I hear a lot of is the rebounding. How's that as a conversation to lymphatic health?
I am quite a firm believer of rebounding. I'm actually signed up to actually become a rebound trainer myself as well. It is quite an amazing treatment. It takes 5 minutes of your day. And some people do it up to an hour, but 5 minutes of your day, we've seen on the measurement scales, it chases your lymphatic system to a speed of 1,000. And that's with touch, how we measure that. That's what I'll show you one day in person. And a lot of my clients who are watching now know how I measure that. But it's an amazing way to actually prevent your lymphatic system from clogging up as well.
Okay, now hang on a second. You just keep giving me stuff that I know nothing about. What's the speed thing? Talk to me more about this guy.
So basically, I can actually, with my hands, has been trained so quite well that I can actually feel the lymphatic system move underneath my hands. So people that come for the lymph drainage massages, I can feel the speed. And that's how I measure how people are actually healing.
Right. So what is the correct speed of your lymphatic system?
So if I count them in seconds, I actually want from your ankle to your knee, I want your lymphatic system to move in 9 seconds when I use my pumps to massage you. So I want a full movement in 9 seconds. And those are the seconds that we count to actually see how the drainage is going.
Wow, that is ridiculous. So in essence, someone can come to a lymphatic specialist and get their lymphatic system assessed proactively.
Yes, and the thing is, which I want to mention tonight as well, which is very important in our field, is we are different. There's a different scope for every specialist. So you get CDT therapists who works with the bandaging and those type of things. I'm a manual lymphatic specialist, so I work manual lymphatic drainage massage practitioner. That's my qualification. So there are people who's higher up that does more advanced type of therapies, but I'm on the physical ground running, doing the physical detox massages.
Right. So coming back to my questions from before, I mean, I wanted to chat a little bit about chiropractic, because what we're talking about in terms of movement, certainly what I see is people that move dysfunctionally are going to have high lymphatic congestion. And as a chiropractor, we work towards, creating better quality of movement. Have you also seen that relationship?
Yes, we do. And funny enough, I want to mention it. We do see it with people who hasn't seen a chiro at all. So we do see a lot of congestion behind the knees. We do see it in the lower back area. We do see it in the pelvic area. And then we do see it around the neck area as well, with sinus congestion and lymphatic buildup in the neck as well. And then we do refer to the chiro. I work hand in hand with doctors like you, and then after that, it's actually better to do a session directly after they visit with the chiro.
Yeah, I mean, as I said right in the beginning, I believe that health is not just by one discipline, and it's so nice to hear, Bianca, that you work with other practitioners. And it's certainly a philosophy of mine, is that chiropractic has its place, but there are other parts of the pie that need to be dealt with. You mentioned dry brushing. Let's go for that one. What is that all about?
Okay, so dry brushing is actually a very well-known technique. It's all over Pinterest as well, but I can supply your patients with the correct module to do it. You can buy a dry brush from any type of health shop, and dry brushing is always about opening up your lymphatic vessels. It's completely dry brushing, standing naked every morning or every evening for 10 minutes and taking a brush and manually manipulating your lymphatic system to drain and to detox. We do see immediate bowel movement, we do see immediate urination, and that's manually manipulating your lymphatic system to actually start rushing, heating up, and draining.
Well, my wife is in trouble because I'm going to buy one of those dry brushes and she's going to be naked for 10 minutes in front of me every day. I like it. You've just given it. I want that written, please. I want it written, okay? So that there's no argument.
Yes.
So that's all the sort of outpatient stuff. What do you really get up to in your office?
So everyday office-based treatment looks like we do welcome people on arrival in the reception area. And then our practice has got 5 rooms. So we have divided our practice in different rooms. So our first room you are invited into is our weigh room. So we do have in-body scales that actually weigh. It's a way for us to measure you. Is it water that we're working with? Is it fat that we're working with? What type of bodily fluids are we working with, and what is your problem? So we do generally weigh people, and then afterwards I do start with a manual lymphatic drainage massage. I do a bit of a technique that's called Botha and a technique that's called Casely Smith. I do have a mixture of that technique where I actually work on the person hands-on and do the hour massage. And then after that, we do have facilities where we've got heated saunas, red light saunas. So we have a strong belief that after your session, you go into a red light therapy sauna, it heats up your core to the outside, and that just helps the detoxification process. That's a normal lymph drainage booking. That's how it looks.
Sure. So it's very holistic. It's not just one-dimensional. It's multi-dimensional in your treatment approaches. That's fantastic.
Yes.
Just to give everyone a timeline, we've got about 9 minutes left. So if there are any questions that you wish me to ask Bianca, please type it in the chat box. I mean, for me, Bianca, I reckon I can ask you another 4 hours of questions. And certainly we're going to have to chat again.
You can come for a massage.
No, I'm on the way. I'm on the way. One thing that I do, and perhaps I'm needing validity or validation for it, I do cold showers. So first thing in the morning into a cold shower. How is that for the lymphatic system?
So I do see a lot of improvement for my more athletic patients that do start with a cold shower or do go for a cold ice bath. There is a lot of movement. I can actually physically feel the movement after the cold shower has been done. And just as good as the cold shower works, just as good the hot shower works as well.
Right. So I'm not doing myself any disservices. So,
No.
you know, for me, the one of the benefits or the purposes of this Finding Health is I want to shine our focus for the future. You know, as I see it, and I'm not specifically pointing out any part of current health models, but I just don't feel that our current health model in this world today is really benefiting us for going forward in terms of living healthier lives. So my question to you is what would you like the future of healthcare to look like from your perspective? I know this is pie in the sky question, but what would you like the future of healthcare to look like for you?
So I've got two answers for you. Number one, a very big concern for me is people not being willing to work with each other, keeping your patients for yourself. I really think that we will do our patients a favor, or our clients, if we start tapping in on our different skills that we have. It's impossible for me to have all the skills. It's impossible for my practitioners to have all the skills. So we do need each other. So I would like, going forward, to have a holistic base in the sense of being able to pick up the phone and phoning a chiropractor or a doctor or a nurse physician, and having that ability and the knowledge that I don't have, so that I can actually give holistic healing to my patients. That's my number one. And my second one is I would really my big love would be for the world to start accepting more of what we do. Massage therapists, chiropractors, people like that. I would like for it to become a normal thing in people's life, to, when they wake up with back pain, to actually have a look and not just go for injections. Not that I say that the medicine doesn't have a place for injections or doesn't have a place in the world, but I do believe we are all born with the type of skill. And I think that it's time that we all stand together and use it.
Yeah, Bianca, I mean, that was certainly one of the reasons why I wanted to start this process, is to be able to join conversations between two pretty much random practitioners. I mean, a chiropractor and a lymphatic specialist, you know, you could quite easily say, what do they have in common? But certainly I can see from our conversation, there's a lot that we have in common. And it's certainly to be able to have open conversation and to chat with different practitioners. And as you said, we all have our niche, so to be able to stay with that. I think also the difficulty is, you know, where do people choose to go first? And I can imagine you're often last on the list. I know that I'm often last on the list. The patient will come to see me and say, I've been everywhere else, and you know, I have no other options, so I've come to see you, and I would like to see that change.
Yeah, I totally agree with you. That's a good point.
So, you know, thank you very much, Bianca. I mean, people are saying it was such a brilliant talk, such an interesting talk. You know, can't wait for the next topic. You know, I think for us, it's really, you know, starting a conversation. And Bianca, I've got to say to you, thank you so much for starting this conversation for me. Is there anything else that you think that people should need to know at this point, what they can, you know, do tomorrow? What should someone start off with tomorrow that they're going to say, hey, I'm going to start improving my lymphatic system?
So I would like everyone, if we can just get 20 people from this talk to actually start drinking water, clean reverse osmosis water, and movement. That can actually just improve your life by 20%. That's the only thing I want to ask you tonight.
Right. Okay, so let's go. We've done the walking one or the movement one. How much water? Let's go for that one. How much water?
Now you want to catch me out. Yeah, it's quite difficult. And for me and for you, and for someone who doesn't have a very complex health system behind them, I would actually suggest 2.5 liters just to start off with.
Sure. And I mean, maybe we're jumping into a whole new conversation, but I mean, electrolytes, how does that fit in? Because a lot of people that I've seen, they can drink a lot of water, but unfortunately they just flush that through their system if their lymphatic system is sluggish. So where does electrolytes fit into that?
We do have all our patients on some type of electrolyte treatment, or they taking electrolytes that they buy from the skin or stuff like that. And we do see a much bigger improvement in moving of the lymph. So I've got a very plain Jane saying where I say your lymph can't move if it's dehydrated. And feeding your lymph water doesn't mean your lymph is not dehydrated. So you need electrolytes for that lymph to actually move and the body to actually retain the right amount of fluids it needs.
Sure. And in terms of electrolytes, what can someone get over the counter that's worthwhile?
Diskin does sell, yeah, you put me onto the spot now. Diskin does sell, it's like a type of a silver leaf. I'll go and check it, but I'll just fact check myself. But they do have these little sachets that people buy and they mix it into a 2-liter water to drink throughout the day.
Well, let's do this quickly now, if you don't mind. If everyone on the call, if you enjoyed tonight, please will you find me or Dr. Bianca on social media and give us a thumbs up. If you didn't receive a message, a WhatsApp message from me, please will you send me a message and I'll add you to the group, which for the broadcast list, which means that going forward, whenever we have another talk, or Dr. Bianca, if you have any information that you wanted to give to people, then you can send it to me and then I'll forward that to everyone after this talk. So if you didn't receive the broadcast message directly from me, please send me a message, 079-639-6976. Send me a WhatsApp now and I'll add you to the broadcast list. And then Bianca, if you've got a few take-home things for the people on the call that they can start today on, that would be fantastic.
Okay, perfect. I'll do that for you. I'll send you our home treatment list.
Fantastic. Oh, Bianca, this was such a pleasure. I really, really enjoyed chatting to you. And I just want to say 23 participants on our first go. I think that is fantastic. And so thank you very much to everyone for joining in. I would like to know what else you would like us to discuss. What other practitioners, if you know someone who is worthwhile for us to interview, please will you let us know. And Bianca, I know that it's not going to be too long before you and I have a chat again. So God bless everybody. And Bianca, thank you so much for your time. I really, really appreciate it.
No, thank you for the opportunity. It's highly appreciated.
Hey, have a good evening. God bless you.
Bye.